Hey guys, welcome back to season 2, episode 2 of Baker Health Talks. I'm your co-host Mo, and today we had the pleasure of interviewing Dr. J, a former psychiatrist turned energy healer. In this episode, you'll see how every day for 10 hours he did meditation for 13 years and how it changed his life completely. Stay tuned.
So this is episode 2 of season 2, right?
Baker Health Talks.
Of Baker Health Talks. And we started this last year literally in a very whimsical way. And then when Mo and I would go to the office after a few months, people were like, hey, who's going to be the next guest next Thursday? Or what are you guys going to talk about? And I would be like, I don't know, Mo didn't seem surprised. I was shocked that people cared. And then it started to pick up momentum. And then I don't know, half the members that we see will bring up ideas and topics. And it became a thing in the past year. And so we kind of tried to elevate the quality of the production. And what I found is a lot of it used to be just me kind of rambling, taking questions. But what people really like to hear is getting into it with subject matter experts beyond just what I know, right? And the good news is that now that I'm bringing in esteemed guests like yourself, I also get to learn, not just the viewers. And so I've benefited from, everything from the top podiatrist to Reiki healer to someone
Hospice.
Hospice and personality types, the whole spectrum, anything wellness related. I don't want to use the term fringe, but I'd say that one of the themes we have is, yeah, we've had cardiologists on. Yeah, we've had, dermatologists on, and that's important. But you can find that other places. And what we're trying to do is say, okay, most of healthcare is broken. Some of it's not. So the some of it that's not, we're getting the best people in there. But for the most that is broken, we're looking for folks who have, like you, like me, a background in healthcare, but recognize that there's the need for more, some unconventionalism, because the convention hasn't served everybody as well as it should.
I like to think of it as cutting edge and even paradigm shifts.
Why don't you, if you don't mind, because I don't want to tell your story for you, take us through your journey, your background, your journey, and then how you got to where you are now, and then we'll talk about what it is you do now.
Well, I guess I could say that the first experience I had where I knew that there was something more than just the surface was when I was 17, actually playing water polo. And something came through me that I knew was kind of beyond me. And that led to a journey culminating in meditating 10 hours a day for 13 years every day.
Starting
not in high school. That started when I was about 28.
How did you come to discover meditation?
Actually, I was having to stay up all night to do a term paper when I was a senior in high school. And a friend came by, and that friend brought another friend. So my friend left, and he stayed, and he started talking about meditation. And he actually drew a diagram of the mind. And when I walked him to his car at midnight, I was feeling so special that every leaf, every blade of grass lit up. And I knew I had to start meditation. And when I learned 2 weeks later, it was extremely profound for me. And then 40 years later, my experiences just completely opened up. And around that same time, intuition just completely kicked in. And then I realized that I could take on people's illness, but not on the surface. It was more like I could take on their causes.
Before you get into that, can you comment? Because I want the folks to understand, you started with a traditional medical, you went to medical school, medical
Yes.
training and so on. Can you talk a little bit
Yes. Well, I had actually an experience inside that I should do what my father does, and he's a psychiatrist. So I did all the training, and that's when, after my training, that's when I actually embarked on this journey to meditate 10 hours a day for 13 years. It was a group that moved around the world, actually, but that was a very inward part of my life. But that was very important to create silence within my system. A lot more had to happen to take me to where I am now. But it was all a very natural progression of my experiences, going deeper and deeper, more full, and then very naturally the intuition, being able to take on people's stress issues, and then a lot more.
A couple of questions on that. I have two major questions before we move forward. One, I find that a lot of people meditate, but a lot more people don't even know what meditation means, and they would benefit. Can you define meditation for those that don't know what it is and how it can benefit you?
No, I'm so glad that you asked this. This is a very, very profound question. I will do my best at answering it. I'll first start by talking about, let's say you take someone who for 50 years they've been doing very deep meditation practice. All of that is deep inside them. That is who they are. And that can be given to someone else. That's a lot of what I'm going to talk about later, is that what we're starting is a way for people to gain something so profound that they can then give it to others. So I'm training other people to be energy workers, energy healers like myself. That's the kind of paradigm shift that can easily be taught others. Others can be trained. So now, one of the experts, we call them energy specialists, who has been doing deep meditation practice for over 50 years, he can actually give the experience of deep transcendence, the energy of deep transcendence to others. So in other words, you don't have to go through the 50 years of meditation to gain that experience, to gain the benefit of that meditation. So there's many kinds of meditation, and there's many paths to gaining depth. Meditation is not the only one. But the goal is really depth. So the mind, your experience goes as deep as you can within yourself, and it is very amazing. But again, there's a shortcut, because someone who has that can give that to you. And so those experts are waiting to give it to others. And I'm training them how to give it to others.
Okay. And my next question is, how long did you practice psychiatry before you transitioned to, I would suppose that there's something on a continuum. They're not completely distinct, but can you talk about the journey? One day you're a psychiatrist seeing patients in an office, and then eventually you go down this kind of more alternative, for lack of a better term, path?
So yes, you're right. There's an overlap. So from the beginning of my practice of psychiatry, I already knew that there was already depth that one can gain, that the deeper you go, the more healthy you're going to be, emotionally and mentally. But I was practicing psychiatry for maybe 6-7 years before the very, very profound changes started to happen. So I did not know that I could help people with energy sessions myself until maybe 6-7 years into practicing psychiatry. So I as an ACT psychiatrist. An ACT psychiatrist is an individual who works as a team with about 7 or 8 other professionals. And as a team, you take care of, completely, not only their medication, not only their employment, not only their anger management, not only their substance abuse, etc., of the most dangerous, the most psychotic, homeless clients in all of the 5 boroughs of New York City. So I was doing that for 3 years full time. And there was one client who Mount Sinai said was the worst psychiatric patient, the worst bipolar psychiatric patient they have ever treated. They had already been through 11 or 12 courses of shock treatment. And they were putting enormous pressure on me as the psychiatrist for the ACT team, who was assuming responsibility on an outpatient basis for this client that was just being discharged, that huge pressure to continue the shock treatment on an outpatient basis. So so I talked to the head of Samaritan Daytop Village, the clinical director, and I said, we really should do deep transcranial magnetic stimulation. They have a fantastic protocol for bipolar patients. I think it'd be much better than shock treatment. They all agreed. I tried to arrange that. I arranged it with the clinic that was providing the deep transcranial magnetic stimulation, and everything was set up. But then at the last minute, Medicare would not pay. So I had to take things into my own hands. Like a few days later, the patient herself called me, said that they're at the hospital getting tests for their heart because she's having chest pain. I knew immediately it was panic attacks, but I immediately said, can I come? So I came. She was at the hospital, and in that structured environment, I confronted her with what her issue was, what I knew it was. From then on, she improved. She didn't hardly needed medication.
What do you mean you confront? Can you define?
Well, so it was at the hospital, and I knew what her issue was that was causing these huge mood swings. So physical illness is not something chaotic and random. There are precise causes. Of course, there are physical causes, but it turns out that the great majority of it are energetic causes. Obviously, that's the case for mental illness, emotional illness, depression, anxiety, mood swings, insomnia, etc. There are specific causes. If you can identify those causes, you can get rid of the causes. And so for her, I just needed to tell her. But it had to be in a structured environment because I didn't know what was going to happen. So she took it very well. And from then on, she improved rapidly. Medication was not needed nearly as much.
What was her issue? What did you say?
She was bipolar.
Okay.
And she had tried to commit suicide innumerable times. And, she was very psychotic. Without medication, she was psychotic. So she rapidly became stabilized so that less and less medication was needed. That she got a job with Amazon and doing fantastic. And there were a few other examples as an ex-psychiatrist of doing what I'm doing now was working. Then I started to use these techniques, these abilities for my regular outpatient mental health clients, and it was working. And then it was just a matter of time before I transitioned out because these techniques were far more effective.
Can you just put like a compare and contrast? Here's the traditional way I was trained to deal with bipolar, mental health issues, anxiety, depression, step 1, 2, 3. But here's how through my energy training, I deal with it. 1, 2, 3, because some of these terms, Doc, are things that I think most people, even physicians, like when you say energy and you say, most physicians really don't know what you mean.
Of course.
So can you just walk us through, here's what I used to do for a patient with severe anxiety, major depressive disorder, whatever. And here's what I do now with the new techniques.
So psychiatrists now mostly do medication management.
Mm-hmm.
If they do some psychotherapy, it's mostly supportive psychotherapy, touching upon some of the issues, but catharsis is the dream of all psychotherapists and some psychiatrists who do psychoanalysis or do psychotherapy. So catharsis is their dream, but is it ever really accomplished? It's very rare. So not only do we do that on a daily basis, but it's the metaphor we use is you're out in the backyard and there's mud covering you. You come in to the kitchen, there's a utility room, and you start cleaning yourself off in the sink in the utility room. And it's a large sink, deep. The mud easily comes off, you're cleaned. That's what we do. It's like the issues that I think of as kind of like the boulders in a river that are blocking the flow. Those boulders are just eliminated within minutes because it's just energy. Your life is just energy, and the blocks are just energy. It's just that the blocks are energy that's twisted. So those twisted energy blocks, which are the issues causing the physical and mental illness, emotional illness, can be eliminated within minutes. All that needs to be done is to identify them, and that's my job, is to absorb those issues. I've been doing that for many, many years. It's all just energy.
So how exactly, that's fascinating. How exactly, I come in, I'm a 44-year-old, major depressive, alcoholic, substance abusing, been in and out, admitted twice for attempted suicide, divorced, estranged, blah, blah, blah. I've gone to a million psychiatrists and been, at Bellevue or whatever. I come to you. How do you identify those knots? And I love that metaphor because I'm thinking of like knots in your back that needs to be massaged out to be released. So the metaphor resonates. But how is it? Is it psychoanalysis? Is it conversationally? What happens exactly?
Well, that's where you get back to the sink in the utility room. So if the sink is very deep, not just 2 feet deep, very deep, all I have to do is identify the precise issue, which is this block of twisted energy, and within a few minutes, I can absorb it. I don't even have to be in the same room.
So you don't have to talk to the client?
I don't. No, I don't talk to the client.
You don't talk to the client?
No.
So so I'm a client of yours. What happens? Are we on the phone? Are we?
Yes.
We're on the phone.
Yes.
And we're not talking.
Correct.
And you're just getting my
It's
energy?
not psychoanalysis.
It's not psychoanalysis.
Well, that's why the metaphor is so important. If that sink is extremely deep, all you have to do is identify the precise issue, and I take it on within minutes. That's all there is to it.
So when you get a client these days who has some mental health issue.
By the way, some of the many clients that I've trained to do what I do were my psychiatric patients. And I get rid of their issues. I get rid of so much of their stress. I open up their system. They're way beyond their mental illness and have risen to giving energy sessions. And there are, I'll go later into the different kinds of energy sessions that we're providing through my clients.
When one signs up, is it like a 2-hour session? Is it over 6 months? Like, what's the contour of it?
So when people sign up for me, the initial evaluation is usually short, 20 to 30 minutes for the evaluation. And then to remove the issues is also pretty quick. But my sessions can last anywhere from 40 minutes to 90 minutes because I'm removing an enormous amount of stress from the individual. But for these energy specialists, those sessions are usually just 20 to 30 minutes, period. It might even be a little shorter, but the average is like 20 to 30 minutes. And I'm actually involved remotely because to give extra power to the energy specialist. But the recipient has to be there next to the energy specialist. All of my sessions are remote.
It's fascinating. This is like this is like, a new frontier for me.
I'm only practicing energy medicine, but as an energy specialist myself, I can coach people on diet and supplements and behavioral techniques. So not everything I will do will be just energy work. And we actually call it deep energy transformation. But that work can be supplemented, especially with the physical problems, with diet and supplements and behavioral techniques. Because there's family dynamics, there's all kinds of things happening involved. And that's all identified in the initial evaluation. But you mentioned physical, so chronic illness. So I can really do any chronic illness. But when somebody is allergic to a food, it may be that is purely physical, but it could be also energetic. Now, I had a client recently who's had very severe allergies their entire life, and they're like 70 years old. And so it took about 3 sessions to improve those allergies by 80%. It had to do with the fact that she was emotionally very sensitive, and that sensitivity was moved away from her emotions into her body. And that's how she developed allergies to everything. So even food allergies, you can work on this energetically. But classically, it would be like...
migraines.
Definitely migraines, for sure. What else?
I know. I'm thinking like there's a lot of the psychosomatic, like where you have the physical manifestations. We generally poorly understood, but we generally believe, as you know, or postulate that there's an underlying emotional or energy issue, and we can't pinpoint it, right? And that, to me, that comes up with like IBS. We have like an 18-year-old girl who has irritable bowel syndrome, fibromyalgia, and they get bounced around from rheumatologist to neurologist to whatever.
All those would be excellent clients for what we do.
Perfect. Great. That's fascinating. I can't wait to go through this exercise.
Yeah, we have a bunch of questions, so
Okay.
Let's get into it. Someone asked, how do you address subconscious trauma?
To me, it's not subconscious. I will know exactly what the trauma is, what are the issues that have been created, and that I will absorb. It's gone. So that's the whole idea, is if the intuition is open, it's so simple and easy to know what are the issues, whether they be from trauma or otherwise. And so, as I mentioned, getting rid of these boulders or the issues is the easiest thing. It's bringing them to a very high level where I have to absorb huge amounts of stress, which I still enjoy, but that takes more time. That I might take 5 more sessions or 10 more sessions or whatever.
Nice. The next question we got, someone asked, how can childhood trauma manifest in adulthood?
All the time. Oh, that happens all the time. Very, very common.
Very common. Nice. Someone asked, I have a hard time meditating and I feel like I'm doing it wrong. Do you have any tips?
I would need to consult with that person, and whatever the blocks are, I would identify, eliminate, and coach them. And whatever would be needed, either my sessions or a session with the deep transcendence energy specialist, whatever is needed, we would get you there.
Nice.
And the thing about meditation is I have people that I know in my life who meditation's a major part of their life. Like I had a medical student in the office the other day, and she's awesome. And at like 1 p.m., she's like, Z, I'm going to be in the like whatever room for the next 30 minutes. Like I thought she had to take a private call or something. And I'm like, sure, whatever. And she came back out after. She's like, all right, I'm ready to go see some clients, members. And I'm like, she looked different. She looked physically different. And I said, what? I said, what did you, like, I thought it was a call or something. She's like, no, I just did my daily meditation. And I was like, wow. And she's young, but like, you could tell she kind of knows what she's doing. But I've had other people that question comes up where they're like, hey, I came across somebody like you who's moving and inspiring. So I went down the meditation pathway, but I'm not getting what I want, because it's also, I don't know, you can opine on this. I think it's one of those things that a lot of people need someone to show them how to meditate, to guide them.
So I'm glad you brought up the meditation again, because we were talking about that at the very beginning. I would never want my wife to do meditation, and she doesn't need to.
Say more.
Well, I meant not that she wouldn't benefit from it, but she's just not the kind of person who should be going down that path.
Okay.
There are other things that we can do for, let's say, somebody like my wife. But for those who have an inclination to go down the path of meditation, we can bring you deeper and deeper, because meditation is all about depth, how far you can go. And I can talk to you about for days just about that.
Can I ask you something? Did I hear you correctly when earlier you said you did 10 hours a day?
For 13 years.
Is that hyperbole or like?
No, that is precisely
I mean,
what I did.
That's an insane number. That's incredible. I've certainly never met any. Like, can we just take a minute and like?
Yeah, that's crazy.
Can you? Do you mind saying a few words about that?
Like because Z will say he'll to our members, he'll say, yeah, meditate in the morning start off as 5 minutes, 15 minutes, whatever gets you to that point of like meditation. But 10 hours is...
For me at that time, that was what was needed. I don't need to do that now. I'm there. And I'm there. I don't need to. In the middle of the night, I'm there. So, but that was needed then. But yes, it was 10 hours for 13 years. You know, sometimes we were sent on projects and then we might only meditate maybe 8 hours, 7 hours. But for most of 13 years, 90% of the time or more for 13 years, it was 10 hours a day. And then for an additional 25 years, it was 6 hours a day. So
do you meditate now?
I don't need to.
Right.
Every time I do a session, it's a meditation.
Right. Okay.
And,
when you walk into a room with like, so we know each other because I take care of your child, but like Mo, Diana, that's my son Dean. Can you pick up on energy?
Oh, no, that's a very interesting question.
Because I'm worried about that one right there. And his energy.
Now, that's a very, very good question. And I'm going to be very, very honest with you. There was a time in my past where I was much more sensitive. But I've reached a level of depth that I've kind of like, the sensitivity is much less. So now to know, I just have to use my intuition. But to feel it, I'm at a level of depth where I'm not as sensitive, just to be frank.
Okay.
Now I have...
Because there's good energy and bad energy, right?
Absolutely correct. So that's a part of another metaphor. You see, I'm sure all of us have been with people where we feel uptight when we're with them.
Right.
And we could feel it maybe in our head sometimes. Right. Sometimes we feel it in our gut. Now, some people will actually absorb a little bit of it. That it's not just feeling it and feeling uncomfortable. They'll actually absorb a little bit of it. And then you have someone who absorbs all of it. So it's a spectrum. And some people...
Is that like, is an element of that body language? I don't want to simplify, but like if I walk into a room, right, and I have none of your expertise, but when I walk into the room as like an average guy, I walk in and like, I can be like, let's say I have a family that just came to the practice for the first time, right? A lot of times it's pretty neutral. You walk in, they say hi, you say good morning, you're taking a history, you're getting to know the family, right? That happens half the time. But half the time you meet them and in like moments, they're like, hey, my brother sent me here. He told me you're a Giants fan. I love the Giants. It's just positivity, and like guards down, and you feel like you've known the guy for and other times you're like 15 minutes into checking their child and getting into them. And it's almost like a cement, like there's skepticism, there's cynicism, there's this and that. And you're like, you know, you're almost, they don't know it, but you're almost doctoring the family before you're doctoring the kid, because there's so much, and you can't put I met them 15 minutes ago. I have no place to judge. I don't know anything about them, but there's this thickness. You've been in the room with me a million times. There's like a heaviness.
Well, by the way, there could be definitely family dynamics involved in any child's illness. That's a part of it. But no, I will feel that. But I meant, will I actually feel your son's whatever issues are? No, I'd have to use intuition, and then I would just take it on. But yes, you know, there's so much stress, and some people have a lot more of it now. And then, but it's also very interesting that you never really know. Like there was somebody who I'm training to be an energy specialist, and she's a research scientist out in San Diego. And I knew from the very first time I did the initial evaluation, this is an incredible person, incredible system. I see it as a system. And
you called the person a system?
Well,
that's awesome.
I see their system.
Mo,
I know the whole system from to the depth, and an incredible system. But there were definite problems that we have to get beyond. And so somebody can come to you with a lot of bad problems, but their potential is unbelievable. And you could just quickly, within days or weeks or months, get past all those problems, and something amazing is shown to themselves and to me and everyone. So, and it's surprising. So sometimes it's almost better that a person has problems when they come to me, because, they go, help me. And you quickly get through all those problems, and you can then really help them at their depth. Where somebody who's pretty happy, doesn't care to come and work at that deeper level.
Nice. So next question we have.
How are you not blown away right now?
No, yeah. But
Am I the only one like every syllable is like mind opening.
Next question. This is a good one. Someone asked, how can you heal when you still have to maintain contact with your abuser, EX father of kids?
That's a really, really, really good question. Excellent question. So there's the surface surface stress, surface despair of having a husband who is an abuser or a spouse that's an abuser. But then there are many more levels to who you are. And I cannot necessarily change the surface dynamics, but I can definitely change who you are, and so that you can handle this situation. And certainly we want to handle the surface, or the surface cause of your suffering. But obviously, if you can really help the person in dealing with it, then that's at least half of the game won.
Nice. Another question we got. So someone asked, is ADD real, and what's the best treatment for it?
So I've gotten rid of ADD even before I did any energy work as a natural practitioner, because I was practicing natural medicine for maybe 15, 20 years. And so there are ways of doing that, and it depends on the person what you do. But together with the diet, supplements, behavioral techniques, and now what I consider to be the essence of natural medicine, which is the energy work, there's great hope to get rid of the ADD, ADHD.
Nice.
And by the way, there's a certain percentage of it, of ADD, ADHD, that is not really ADD or ADHD at all. I mean, it's logical. But you have to look at the causal level. And we don't. And so once you do start looking at the causal level and get rid of the causes, you could do so much more.
Because that's something we see like rampantly, right? Is these ADD, and in adults too, but especially in kids. Can we just go like one tier lower on this? Because let's say there's a family, they have a 9-year-old. He's been told by 3 different school psychologists he has ADD. The teachers more or less concur. You talk to the parents, they feel like, I looked online, he has more of the symptoms than not. You're looking at, I look at the kid, and he's sitting there for 20 minutes. Me and Mo are dealing with the kid. For 20 minutes, he's not moving. He's engaged. He's interested in what we're talking about. He's a healthy kid. He's a kid, so he does kid stuff. But I can talk to the kid for 25 minutes, like easy, while I listen to his heart, joke with him about basketball, whatever. And the family says, no, Dr. Baker, he's not a bad kid, but like he can't sit still, blah, blah, blah. Right? I get this all the time. And, before they moved in from the city and he's on Ritalin for 3 years, I get this all the time. And as the primary care guy, I know what you're saying is true. And many doctors know that. They don't have, I don't want to say the guts. That would be disparaging. I want to say they don't have the academic fortitude or societal support to go out on a limb and say, well, listen, I don't think everything you've been told is wrong. That's not what I'm saying. But the child has in them the ability to control or not have the ADD.
Now, there's a couple points here. First of all, for people who don't know it, it's extremely common that a child or an adult with ADD or ADHD can focus perfectly well if they're enjoying what they're focusing on. It's when they don't enjoy it, they can't focus at all. So it's at that point in time, there's no blanket protocol that works for everyone. It's very individual as to what is causing the problem in that particular child or adolescent or adult. And so that's where there must be an evaluation at this level as to what the causes are, and those causes must be eliminated. So, by the way, I'm finding that 90% of all the physical cause that I'm saying is energetic, and 10% is the physical that you have to address on a purely physical level. So for ADD, ADHD, I'm sure the percentage is extremely high that it is energetic. So what is causing that? Now, we know that the prefrontal cortex that inhibits the rest of the brain is not working. So the stimulants are actually awakening the prefrontal cortex so that the rest of the brain is inhibited. So you're calm enough to focus. But why is the prefrontal cortex not working? And often there's some stress, some trauma that all of a sudden they have the symptoms of ADD, ADHD. So that's got to be at least a common cause. But there's bound to be other causes. And then it gets more individual.
What's the main reasons behind the immense amount of mental health disorders in our kids today?
That brings up another whole area, which is fantastic, which I've actually talked to you about at your office. And that is a kind of a collective effect. Because the frequency of mental illness was higher maybe 6 months ago, a year ago. As you may recall, I said it's going to be coming down.
Yeah. After COVID, high, then coming down, right?
I'm predicting in about 6 more months, it'll also go down. So there is a collective phenomenon here. Now, I'm sure it has something to do with our society. I love America, but I'm sure that there are certain aspects to being American, to being in America, that might help create some of these problems. Something to do with family structure or culture, whatever. But I'm very optimistic that, mental illness can be brought down, and will come down more and more on a large basis, on its own, we could say. But on an individual level, I'm totally optimistic.
So the next question we have, someone asked, what % of folks on pharmaceuticals for mental health issues, in your experience, actually have to be on them?
I don't want to delay giving you an answer for too long. Okay, I'll give you this. I'll answer it this way. I had a woman come to me who was in total mania, totally psychotic, not sleeping at all, out of control. She refused all medication. And all I did, because she had no money, pro bono, I gave her IV amino acid drips that are 4 to 5 hours long. I did only half dose because she wasn't paying, and it's very expensive. And I only did it once a week. And normally it's like every day for like 7, 8 days in a row. And every week her mania was hugely better until a few weeks later it was completely gone. Now, the mania came back a year and a half later because I didn't get at the root causes of it. So if you can address the root causes of mental illness, and even severe mental illness, then, and especially with supplements, you can really help a person. And that person who was the worst bipolar that ever came out of Mount Sinai, who we quickly stabilized and hardly needed medication, only with really one session, I'm very optimistic that we can get people off of medication. But I also don't want to step on the toes of the medical establishment and all the psychiatrists who are doing a fantastic job out there. But certainly they would continue their medication when they come to see me. And they can be, talking to their psychiatrist as they're improving to reduce their medication.
Nice. Awesome. And then a couple more questions before we wrap up. What is the single best thing someone can do to maintain strong mental health?
One thing I will say this knowing that it's not going to move most of you that are listening. But my whole life, I had a passion for going deep. That was my only passion, was to discover who I really am at my depth. And everything I did was for that purpose, for decades, for 60 years. And so if there was one thing that I would suggest is for each person to go deeper within themselves, to discover who they really are, to somehow throw off that which they aren't, and the depression and the anxiety and the mood swings and all this is covering up who you really are. Once you begin to have an experience of who you really are, then you're on what I consider the journey. And then you really want to discover the depth. And that journey will only create more and more mental health.
Nice. And then last question to wrap up. I mean, this was an excellent talk. I just want to know how can people find you? How can they reach out to you? How can they reach your services?
So I would invite everyone to go to our website, which explains to a great extent what we provide and how to take advantage of our services. And the website address is yourworldinside.org. yourworldinside.org.
This
was excellent.
Can't thank you enough. Good to
okay.
see you.
Thank you so much.
Tell
And
the
thank
little
you
guy I
again
say
for
hi.
all you've done for my son.
No, you're kidding. It's a pleasure. Thanks again, man. This was excellent. Looking forward to doing it again.
Fantastic.